Hello, I'm Lisa Carter and I'm here at WHO working on the laboratory networking team, and I want to welcome you to Module B, Unit 2 on laboratory investigations. So the learning objectives for this short course, we want you to be able to describe different kinds of sampling needed and the type of laboratory investigations used to confirm cases of COVID-19. We usually use real-time PCR to detect viral nucleic acid in samples, but in some cases we can use serology to look for antibodies. In these cases, it might be used to investigate an outbreak or to retrospectively confirm an infection. If you're using serology, you must ensure that 2 serum samples are collected, one from the patient in the acute phase of illness and one in the convalescent phase of illness. For people who have symptoms, if we want to test them through PCR, we would look for 2 main different kinds of sample. The first is samples from the lower respiratory tract, and this is going to include sputum, bronchial lavage or aspirate. And we can also look for samples from the upper respiratory tract, including nasopharyngeal and oropharyngeal swabs. In some cases, we can look at other sample types as well. It's been shown that the virus can be detected in such as stool samples. But for PCR, we look for respiratory samples. We also might want to be testing people who have no symptoms. These might be people who have come into close contact with a confirmed case of COVID-19. So even though they don't have symptoms, we would want to look at nasopharyngeal and oropharyngeal swabs. But we'd have to make sure that these swabs are taken from the patient within 14 days of this person's last close contact with a COVID-19 case. It's also very important to look at IPC and appropriate sample collection techniques. So all healthcare workers who collect specimens from patients with suspected or confirmed COVID-19 must wear the appropriate personal protective equipment. And all of those involved in collection and transporting specimens should be trained in the safe handling practices and decontamination procedures. And once the sample has been collected, you want to make sure that you're storing it and transporting it appropriately. If you're sure that the specimen is going to reach the lab in less than 72 hours, you can store it and ship at 4 degrees C. If the specimen will reach the lab in more than 72 hours, store at minus 80 degrees Celsius and ship on dry ice or liquid nitrogen. For more details, you can refer to the WHO guidance on shipping samples for COVID-19 testing. On occasion, negative test results might be obtained from a person who's infected with the COVID-19 virus. And this could be due to a few different reasons, including poor quality of the specimen that was taken, that the specimen was collected late or very early on in the illness, the specimen was not handled or shipped appropriately, or it could be technical reasons inherent in the test, such as virus mutation or PCR inhibition. Now, the best thing to do if you get a negative test from a patient who you suspect is very likely to have the virus is to repeat the test. If a negative result is obtained from patients with a high index of suspicion for infection, new specimens, including some from the lower respiratory tract if possible, should be collected and tested. And any labs that have not validated their capacity to detect coronavirus should send the first 5 positive and the first 10 negative samples to one of the international reference labs for confirmation. If there are any questions or comments, the lab diagnostics team can be reached at whelab@who.int. And please keep checking the website for updated interim guidance on COVID-19 diagnostics, including biosafety and transportation of samples. And thank you for your attention.